This project was done through Ball State University Master's Program through the SPCE638 class. The topic of training today is the prompt hierarchy. I will discuss why prompts are essential, how to use them, show examples, and describe both least to most prompting and most to least prompting. During this staff training, I will discuss what prompts are, why they are essential, prompt hierarchy from most to least and least to most, different types of prompts, definitions of each prompt, and provide examples of all prompts for visual, verbal, gestural, modeling, partial physical, and full physical. What are the prompts we use in ABA? They include 6 prompting methods. They are visual, verbal, gestural, modeling, partial physical, and full physical. However, there is also proximity or positional. I will be talking about that later in a slide. Prompt hierarchy is a systematic approach that outlines the order and progression of prompts used during teaching or interventions. It establishes a clear structure and framework for gradually fading prompts, allowing individuals to become more independent in their behavior and skill performance. The significance of the prompt hierarchy lies in its ability to promote skill acquisition while minimizing prompt dependency. By starting with more intrusive prompts and gradually fading them, individuals are encouraged to rely less on external cues and prompts and instead develop independent problem-solving decision-making skills. By following a well-structured prompt hierarchy, educators, therapists, and caregivers can effectively scaffold learning and provide appropriate support based on an individual's current skill level. This helps to ensure that the individual progresses through the learning process at a pace tailored to their needs. This increases the likelihood of successful skill acquisition and generalization. Understanding and implementing the prompt hierarchy within the ABA framework is crucial for promoting independence and long-term skills retention. As a result, individuals are empowered to apply newly acquired skills in various settings and situations, leading to meaningful and lasting behavior changes. Why are prompts essential? They are essential because it supports independence, generalized skills across settings and people, reduces prompt dependency, ensures client does not rely on additional help, provides more effective instructional time, guides the client towards being able to participate and actively participate in an activity or group setting, reduces frustration time, and increases responding time for clients. Here is the hierarchy in both least to most and most to least. On the left-hand side, you will see least to most, starting with independent, positional, visual, verbal, gestural, model, partial physical, and physical. Then on the right-hand side, you see the most to least, which starts with full physical, partial physical, model, gestural, verbal, visual, positional, and then independent. It is important to note proximity or positional. This happens when a therapist is placing the target item closer to the client so that the answer is right in front of the client's face. For example, on the sheet, you can see that the train is forward and the 2 slinky and balls are in the background. Therapist places all 3 toys in front of the client. The target is the train. It is in front of the slinky and the ball, therefore the client is more likely to choose the train. Again, here are the lists of levels of prompts, starting with independent, which proximity and positional would be next, gestural, verbal, modeling, partial physical, and full physical. Here we will start defining each of the prompts, starting from least to most prompting. First, we can see independent is first, where the client does not require any prompts. The second is proximity or positional. Positional prompts are stimulus prompts in which the therapist manipulates the position of the objects to encourage a specific response. The therapist provides a visual cue that directs the learner's attention by placing the correct item closer to the learner or in one more prominent position. This increases the likelihood of the desired behavior. Here, we will move on to gesture and visual. A gestural prompt is a cue or hint that uses physical gestures or movements to guide a learner toward a specific action or response. Some examples could be pointing to an object to indicate what the learner should pick up or interact with, nodding as to indicate if you're saying yes or no, eye contact to the direct learner's attention, hand movements to help indicate a specific action. Visual. Visual prompts are used in ABA therapy. They use a variety of cues such as pictures, photos, videos, or other visual aids to convey information about the correct response or behavior. They serve as a reminder or cues for individuals to follow through with specific tasks or behaviors. I will be discussing modeling and physical prompts. Model prompts demonstrate an individual's desire, behavior, or task to imitate or replicate. The therapist or caregiver performs the action or behavior, serving as a model for the individual to follow. Model prompts can teach many skills, including social interactions, play skills, and daily living activities. Model prompts visually represent the desired behavior, making it easier for the individuals to understand and imitate it. They are particularly effective for individuals who learn best through observation and imitation. Model prompts can be combined with other prompts to enhance learning and skill acquisitions. Both physical and partial prompts involve guidance or assistance to help an individual complete a desired behavior or task, depending on the individual's needs and abilities. Physical prompts can range from full physical support to partial physical guidance. They may include hand-over-hand assistance, gentle touches, or physical cues to guide the individual's movement. Physical prompts are handy for individuals who require direct directional assistance to understand and perform a specific behavior. They can effectively teach motor skill like hand-eye coordination or fine motor movements. However, it is essential to fade physical prompts gradually to promote independence and reduce prompt dependency. Here we can see an individual completing independent work on its own. In this video, we have an example of proximity or positional. Here we can see the caretaker picking up the individual's shoes and placing them in the right area so she knows exactly right foot to the right shoe and left shoe to the left foot. In this video, we see a therapist with a client going from least intrusive, which is independent, to full physical. Here are 3 examples of most to least prompting. Each one starts with full physical and ends with the individual doing it independently. Thank you for watching my training video. Please feel free to reach out with any questions that you may have.